Welcome to today's discussion of possible ways out of COVID-19 pandemia. As you can see, I have to wear a mask because of the infectious situation. We'll be talking about immunity, and I see nobody around here in the next 6 feet, so I'm going to take my mask off so I can speak more clearly. I'm Dr. Pavlovic. I completed medical school in Aachen, Germany, and a doctoral degree after cardiovascular research. I had a internal medicine residency in Tennessee and internal medicine practice in California. I practiced forensic psychiatry in California, and now I'm conducting health presentations to help people with medical and emotional problems. We're dealing with an invisible enemy. Coronavirus is COVID-19, lives in the area, they say possibly up to 3 hours. We need to get more familiar with this enemy here. He gets positioned in our nose, in throat, can create sore throat and dry cough and shortness of breath. If the virus doesn't get under control, he slides down the pipes into the airways and creates inflammation of our bronchi, there creating swelling of the tissue, closure of the airways, wheezing, and it can very quickly lead to acute respiratory distress. It has an RNA unstable capsule around the membrane, and this leads to various mutations, and therefore it is believed that this COVID-19 comes out of the animal kingdom infections, and through one mutation or other around 2005 then became pathogenic even for humans and other mammals. Droplets are transmitting the infection, and this usually happens by speaking, coughing, sneezing. This is the primary way of infection, but however, because the droplet is heavy, it falls down to the ground and contaminates all the surfaces that are around. So we need to become cognizant. What do we touch when we come in? Windows, doors, tables, chairs, telephones, anything, and to realize also how long is the virus going to be alive on those surfaces. For one thing, we know it cannot live in the water. It doesn't swim. That's good. And because the membrane is so unstable, washing with warm, soapy water is going to kill it very quickly. And so this is one of the recommended ways of helping us. But on the other side, we see that it takes about 4 days for most metals, copper 4 hours, plastics 1 to 2 days, 2 to 3 days. Then we see wood up to 4 days, and so it's good to know those things. Vigorous fight is washing hands very frequently and up to 20 seconds release to get all the surfaces of our hands connected, clear, washing frequently, and then maintaining distance to other people 6 feet. This is one of the very effective ways of reducing our exposure. this coronavirus is one that infects people so insidiously that they don't know that they're infected. It takes 3 days before symptoms may develop. But in many people, the symptoms are very, very mild until all of a sudden they erupt and lead to respiratory distress. People can be carriers and infect other people without knowing it, which makes it difficult to control them. So our survival with this kind of enemy depends on two things: isolation, effective reduction of our exposure by distance, washing hands, and masks. There are various discussions on the internet, to wear a mask or not to wear a mask. Basically, mask is going to reduce the infecting other people if we are infected. But mask is going to reduce also the number of all kind of droplets for anybody. So it is a useful measure in this time. So if you're somewhere where there's nobody around you in the room, there's no need to wear a mask. But depending where it is, if you're with people, and especially in a closed space, that's the environment that the virus can live up to 3 hours. That's important to wear a mask and also to minimize any kind of exposure and any kind of possibility that you may be infecting other people. And so other way of increasing our possibility of survival is by increasing our immunity. So here we see numbers. They're already outdated, but I just want to focus here on 3rd of April. Globally, there were over 1 million cases, and there were over 55,000 dead. In one day, 1,344 people died, and this was a couple of days ago, on the 5th. At that time, in the United States, there were 321,702 cases. So we better understand really how serious this situation is. Many of people have never woken up because it was going so fast with them. So how to boost our immunity? Without immunity, actually, and immune response, our body would be completely at the mercy of all viral, bacterial, and pathogenic invasions in our body. But we have a cellular immunity with specialized granulocytes, lymphocytes. More specifically, we have T-cell helpers and suppressors, killer cells that kill actually cancer cells, and they're important in immunodeficiency syndrome as well. But what is important here is, to maintain those cells in healthy numbers, which requires healthy nutrition, as we were talking, and we'll talk more about it. So humoral immunity is the other part, and that is where antigen antibody is used to control us. I had a experience with SARS in 2013, and it is believed that COVID-19 is actually out of the family of SARS, and actually his name is oftentimes cited as SARS CoV-2. So what happened in my case, I was working, probably got infected. I was not noticing that. I got home. I was kind of tired, low fever was there. And we had a visit of my wife's brother and his wife, and we were going to celebrate our anniversary. We drove down to Southern California. And on the way there, I developed fever of 104. We visited 5 emergency rooms. They treated me with Tylenol and sent me home. And when we came into San Diego, it didn't get any better. So we turned back and had the same experience here in Roseville. But on insistence of my wife, they admitted me. And guess what happened 2 hours later? All of a sudden, I could not breathe. My oxygen consumption saturation dropped down, and I was intubated and was on respirator for 20 days. So I'm so glad that this happened in 2013, because if it happened today, there's not enough respirators to do that. So we see, I'm thankful to God for his intervention, because they did not know what to do as my oxygen saturation was dropping deeper and deeper. Only God's intervention is one that can explain what happened, and I'm thankful for that. So our immune system, as we said, is cellular immunity, and we have humoral immunity. And how can we boost our immunity? What can we do? So we can minimize our exposure to the COVID-19 isolation. That means, wearing masks, as I explained, 6 feet distance, washing our hands 20 seconds, developing healthy lifestyle. And so healthy lifestyle can boost through our daily habits: nutrition, exercise, moderately judicious use of water, exposure to sun, stress control, use of fresh air, sufficient sleep, and trusting into the divine power. Generally, we see how nutrition can affect our immunity by using superior products of plant proteins, fruits and vegetables, and then eating habits, regularity of meals, keeping optimal weight. We're using quality food products for cardiovascular improvement, reducing cholesterol, fat, and sodium. And then also we're using a diet that is going to be emotionally improving. So tryptophan, which is transmitted into serotonin in the body and helps to fight the infection, the depression. Now, it is found in oats, 234 milligrams in 100 grams. Omega-3 is also there, and flaxseed, 6,388 milligrams in 100 grams. So we have then more specific foods that boost immunity, specifically all the vitamins, but primarily antioxidants. Vitamin C, recommended 5,000 milligrams a day, boosts general resistance of body against invaders, pathogens, and infections. Then vitamin D, very important, especially controlling and reducing the infections of respiratory tract. 50,000 units a day for 5 days, and then 4,000 units, international units a day to continue. Also, we see a recommendation to use lemon with warm water and bicarbonate, which has shown some help and improvement. Then we see a recommendation for use zinc, 20 milligrams a day, which reduces the intensity and duration of infections. Then echinacea, which reduces the intensity and duration of viral and bacterial infections. For preventive purposes, it is used 2,400 milligrams a day, but for treatment, it requires 4,000 milligrams a day. Then we use garlic that has allicin as a substance that also reduces the intensity and duration of infections. Turmeric is very powerful immune boost in our body, especially in combination with the ginger and honey. Ginger helps our digestive tract to eliminate invaders. Papaya has also a lot of antioxidants. We need to talk about green leafy vegetables, which are all containing the antioxidants, and then also not to forget probiotics, lactobacillus, which maintain the healthy darm flora. And when we see that, we realize that we have done everything that we can think of. Body immunity is combined with various factors, and now next week we're going to be talking about the effect of exercise on our immunity. Thank you very much for your attention.